Hello people, in this video let us look at drugs that you will have to use carefully if the patient has liver disease, hepatic condition if they have. That means these drugs you'll have to use very carefully because they can have see, some of their effects can get enhanced. That is, the pharmacodynamic effects of these drugs can get enhanced, right? So warfarin, if its action gets enhanced, what will happen? Yes, it will cause reduced clotting, that is bleeding. Increased anticoagulation can become there, right? You understood? So warfarin's effect will become enhanced. Metformin's effect will get enhanced. So there can be lactic acidosis. See, metformin is actually removed by kidney. However, in liver disease, you should be careful because it can lead to what? Lactic acidosis. Very good. What are we looking at, people? Drugs which you should take precaution while prescribing to liver disease patient. Chloramphenicol. It is used for what? Chloramphenicol, ENT, ophthal, those people use. Bone marrow suppression it can lead to, okay, because of liver disease, remember. NSAIDs, so basically if you're giving this, it can lead to what? Gastrointestinal bleeding, fluid retention, it can lead to, okay, fluid retention. What comes under NSAIDs that will cause this, where you should be careful? See, definitely paracetamol is not NSAID, right? It is not an anti-inflammatory. So anyways, NSAIDs if you give, it will cause gastrointestinal bleeding, fluid retention. Now coming to sulfonylureas that you will use as anti-diabetic agent oral, then that can lead to hypoglycemia. So what are the sulfonylureas? Tolbutamide, glibenclamide, lipizide, gliclazide, glimepiride. Can you remember at least two? Glimepiride, glibenclamide. Okay, good. All these Glees are sulfonylureas. Okay, what do? They enhance insulin secretion by doing some potassium channel blocking. Okay, they are oral anti-diabetic drugs. Very good. So now here we are you should be careful while giving in liver hepatic disease people. Benzodiazepines, like example diazepam, example, right? So this can lead to coma. Benzodiazepine if you give. Actually, you just wanted to sedate that guy and he went off into coma. Yes, enhanced effect. You got it. Okay, now let's move on to the next slide here. See, some of them will have reduced clearance. So they will have their enhanced effect again, right? So because of their reduced clearance, you'll have to adjust the dose, etc. I am thinking. Phenytoin, anti-seizure medication, right? Then rifampicin. Rifampicin, where will you give? Yes, think. Antitubercular. Very good. Antitubercular drug, propranolol, you will give for migraine, etc. Right? Otherwise, where do you use propranolol in reality? High blood pressure, it says migraine, pheochromocytoma, migraine prevention usually, people. Okay, so now let me get back here. A lot of uses are there, like anxiety, angina, arrhythmia, heart attack, tremors, all that they are treating. Warfarin. Warfarin, where will you give? To prevent stroke, deep vein thrombosis, etc., to prevent pulmonary embolism. So basically to prevent the formation of blood clot, that you know, right? Diazepam. Yes, you will use in status epilepticus and other things to sedate the patient, right? Lidocaine. Lidocaine is nothing but local anesthetic, right? So it will have reduced clearance. So you may need lesser dose, I'm thinking. Opioids, like example morphine, that is to reduce pain, right? If you're giving, you may need less because it has reduced clearance. It will be there longer in the body. You understood? Because the liver is not working well. So you have looked at the drugs that have to be used carefully in liver disease. You understood, right? So let me revise these drugs. Warfarin, metformin, chloramphenicol, NSAIDs, sulfonylureas, benzodiazepines, and phenytoin, rifampicin, propranolol, warfarin again here, diazepam again here, lidocaine, opioids. I think these two are repeating, correct? In the list. Okay. So now let me tell you some more things, okay? There are some drugs which cause hepatotoxicity. So now that this guy already has liver disease, should you give these drugs? That is something that you will have to decide, okay? Acetaminophen, paracetamol, okay? Chlorpromazine, then estrogen, then NSAID we already told you, amoxicillin, statins, rifampicin we told you, isoniazid, amiodarone, busulfan, azathioprine, methotrexate, very important to know, nitrofurantoin, then some anti-cancer drugs like nivolumab, etc., tetracycline, so especially in pregnancy, sodium valproate, propylthiouracil, niacin, that is vitamin B3, then teriflunomide, tolcapone. All these drugs can lead to hepatotoxicity. Now, I'm thinking if a person already has liver disease, would you give these drugs, right? So I'm just putting those drugs here in this PPT, in this PowerPoint presentation, just that I will leave to your discretion. Our list is this: warfarin, metformin, chloramphenicol, NSAIDs, sulfonylureas, benzodiazepines, phenytoin, rifampicin, propranolol, lidocaine, opioids. Bye bye.